Okay, we're going to get right into council and committee, and apologize for the delay. We were just at an appeal hearing, which carried on a little longer. So we do have our council and committee, and Josh Henshaw and James Tull for the regional vice presidents of the ambulance paramedics of BC. Are you? Yes. Perfect. Do you want to come forward? And you've got 15 minutes allotted, including any questions we may have. So please proceed.
So James wasn't able to make it. This is my colleague, Aaron Shapiro.
Good evening.
So we're regional vice presidents with the ambulance paramedics, and we represent the Metro region, Sunshine Coast, and Sea to Sky. And so we're here to talk tonight about community paramedics and about another new paramedic profile that we're hoping to see. Thanks for seeing us tonight. Congratulations on a distinguished career, and congratulations, Councillor Hepner.
Thank you.
Who knows what a community paramedic is on council? Disappointing.
Okay, well, you know what, just give us your presentation. We're well aware of the paramedics. We're well aware of what's going on in the community and some of the initiatives underway, so please go ahead.
Okay, so with the Community Paramedic Initiative, the Ministry of Health is looking to have community paramedics in place in BC in summer 2015.
Yep.
That's pretty soon. As you guys probably know, you're not engaged in an assessment process for your community needs. And what we're here tonight is to say that the province has allocated $15 million to start the program. They've committed to 80 full-time positions in the province. So now is the time to put up your hand if you'd like to see community paramedics in your municipality. And in Surrey, you've got ER crowding problems, which is one of the key things that community paramedics are targeting. They're targeting a reduction in 911 calls, a reduction in ER crowding, and actually a reduction in hospital admissions as well. Are you guys familiar enough with how community paramedics accomplish that?
Okay, why don't you just give us the presentation? This isn't a quiz. Go ahead.
Okay. So,
because there's also people in the audience that don't have the information as well.
Okay.
So just do your presentation.
Yeah.
Perfect.
Community paramedic is like a paramedic that does non-urgent house calls. And the idea with healthcare provincially is they're moving towards more integration between different agencies. So a community paramedic will be referred by a physician in an ER. They may be referred by your municipal police agency. They may be referred by an emergency paramedic who visits a patient. And it's a program that's been used in jurisdictions throughout Canada, in Toronto, Winnipeg, throughout North America, and huge in Australia as well. And they are seeing drastic reductions in the targeted populations in ER visits. So for example, in Calgary, they're sending community paramedics with home care nurses visiting extended care facilities, doing things like specimen collections, catheter maintenance, and they're reducing ER visits from those facilities in the hundreds per year, which obviously saves a lot of money and deals with the overcrowding, which deals with ambulance wait times. Yeah, so really with the community paramedic thing, like you said, you've heard it. We're just here to say now's the time to put up your hand. We've got another initiative called a ambulance PCP PRU, Paramedic Response Unit, which is a single paramedic responder which responds to 911 calls and assesses what further needs to be sent to that patient. And these will be trained to assess whether they need a paramedic staffed ambulance to transport that patient to a hospital, or perhaps they need a community paramedic to follow up the next day and they don't need to go to the ER. Perhaps they need a referral to a home care nurse or another agency. So again, this is a program that is targeting to reduce ER visits from patients.
So just to jump in here, so who triages that? Is that through ECOM?
No. We have our own in-house dispatch with BC Ambulance Service,
okay.
And ECOM does police and fire. So It's triaged through our dispatch, through the AMPDS system, and then it's actually a professional paramedic who goes to the house and assesses the patient and sees what they need as far as an ambulance to take them to the hospital or another resource. And it's a more efficient, less invasive method of responding in a timely manner than we currently have in the Lower Mainland. So again, we had success dealing with our employer and dealing with the province with community paramedics and getting some funding. This is just another tool that we were hoping municipalities will go to the Minister of Health, talk to your local MLAs, try to get these resources in your community. It helps us with ambulance wait times. It helps your citizens with ER crowding. So that's basically what we're asking, is for you to go talk to the Minister of Health and your MLAs and ask for these resources. And when you have your pen and paper out and you're writing these letters, we always want more ambulances as well. We did a report in 2012 that demonstrates we're short about 22 ambulances in the metro region. And as you know, provincial model, dynamic model, fluid model ambulances don't necessarily belong to Surrey or Delta or New West. So we can't really say you need 2 ambulances in Surrey. We just need all of the municipalities to come together and say we need 22 ambulances in the metro region. So those are sort of our 3 action items, is put your hand up now if you want community paramedics in Surrey, and trust me, you do. Ask for PRUs at the same time, and ask for more ambulances.
Okay, now who does the needs assessment for each community?
All the relevant stakeholders. So for Fort St. John, that's going to look a lot different than Surrey.
Right, okay, so if we're just talking about Surrey, who does the needs assessment for Surrey?
One thing we're finding right now, especially with the metro regions, is that it's not happening metro. They're looking at rural options. So it's going to be the Ministry of Health, it's going to be the City of Surrey, it's going to be the local health authority, it's going to be the ambulance paramedics, it's going to be all the stakeholders doing the needs assessment.
Okay, so what's the focal point? So in order to do the needs assessment, you need a focal point. So where is that? Is that Fraser Health that's doing that? Is it someone in the ministry? Is it someone in the ambulance service? Who's leading this?
Currently, right now, nobody's leading it in metro regions, and that's sort of why we're here, is we're saying there's 80 full-time positions that are going to be divvied up amongst the province. And
okay, but who makes that decision?
That's going to be the Ministry of Health that ultimately makes that decision.
Okay, so within that context, how is the needs assessment going to be done? It's
going to be, again, the squeaky wheel is going to need to squeak, and the Ministry of Health and BCEHS and the ambulance paramedics and the health authority are all going to have to sit down and do that needs assessment.
Yeah, because I mean, at the end of the day, I mean, you want efficiencies and good value for your dollars. So if there's 80 positions, the allocation of those 80 positions, I would expect, would be more rural in nature.
Those 80 positions are all going to demonstrate savings to whatever health authorities they end up under, and they're going to demonstrate, reductions in ER. So limiting it to 80 positions doesn't really make sense, and we're fully expecting there's going to be more positions once these savings are demonstrated in metro and rural areas.
Okay, but what's the allocation? What's the allocation for the Lower Mainland?
It hasn't been allocated yet.
Okay, so what process are they in right now?
It's a bit of a game dealing with the Ministry of Health, figuring that out. As far as we know, none have been allocated, but they're talking about placing them for the summer of 2015, and as you know, that's very soon. So, you'd have to ask the Minister of Health at what stage they're at in allocation provincially.
Okay, so but I would expect that yourselves would be advocating to have those positions within X amount within the Metro Vancouver area, X amount within the interior, and X amount in northern BC.
Honestly,
what advocacy role are you guys playing?
our advocacy role is right here saying we want to create demand for 250 of these positions because they've demonstrated how effective they are across Canada, throughout North America.
Okay, so you're saying that you need 250.
80 is not enough to start in British Columbia.
Okay, so you're saying that 250 is the number?
It's going to be based on the needs assessment with each municipality.
Okay, but who's doing the needs assessment? Like, where did you get the 250 number from?
I'm just making the point that it doesn't need to be limited to 80. When we started looking at the community paramedic profile, there were 0 committed positions. Now we're at 80. But in Surrey here, you haven't started your needs assessment. You don't know the process. We don't know the process. And they're going to start handing these positions out. And we're advocating for metro regions, metro places like Surrey, because we could see a huge benefit of having community paramedics here. It's not up to us to allocate them, but we do know that if you put up your hand, that can start the process for the metro region.
Right, but obviously there has to be a significant amount of work yet to be done, because I can put my hand up and say I want community paramedics. How many? I can't answer that question. So there's got to be a process. There's got to be a focal point, which I'm sure that you're at the table. Who's at the table doing that, identifying those pieces where the work needs to be undertaken?
The only thing we hear is when Terry Lake is on camera saying we're going to have community paramedics out in the summer of 2015 in rural BC. Okay,
so your delegation is based on an announcement that he made?
Well, it's also based on the fact that these 80 positions and the $15 million to implement are in our collective agreement. It's actual funds.
Okay, so that's within your mandate then?
Providing the paramedics, but not allocating.
Yeah, no, I understand that.
Yeah.
Okay. All right. Councillor Villeneuve?
I guess the mayor and I were saying, of course, we put up our hand. We put up our hand all the time with the province talking about needs. We usually have a background of information to justify why we're asking. So I think what this council needs is some information on whether there's going to be a committee, possibly through Councillor Martin's Health Committee, or whether you're working with Fraser Health that allocates its resources to our hospitals here. Yeah. Really, because if we just say we need more paramedics without a case to justify that, we really can't get any attention, I'm certain. So I think what might be good for you is to supply us with information that you have, and then we could direct some of that information to a committee that could look at it from a broader range.
Yeah, and so you should have received the electronic document that outlines some of that information. And we're trying to be more specific than just asking for more paramedics. We're saying 80 full-time positions have been approved, and the funding to implement those has been approved, and they have not yet been allocated. And
so what kind of negotiations have you had so that we could justify the demand for allocation then with the provincial government?
Well, to get to the point where they're willing to spend money on the program, they've seen the examples from across the country and throughout North America. Frankly, Aaron and I we're part-time paramedics, like a lot of paramedics in the Lower Mainland, and it's sort of the next level that's done the negotiations to get it in our collective agreement. We do have and there's a link to this in the electronic document, a framework manual for implementing the program, and one of the recommendations in that framework is the assessment needs. And so when we hear Minister Lake saying that these are coming next summer, we want to come to the areas where we work and say, if you're not doing a needs assessment yet, you need to figure out why and who isn't asking you or who is. But
Okay, I understand that. Thanks. Thanks.
Okay, Councillor Hain?
Thank you, Madam Mayor. Just a couple of questions. You referenced rural BC. So first of all, is this a pilot project, or is this going to be in perpetuity, these 80 community paramedics? Because I guess you bargained that into the agreement.
Yeah.
So my first question, is it a pilot project, or is this fully funded going forward? And secondly, you mentioned rural BC, so clearly there's, and in your own document, there's lengthier wait times in rural BC than there is in Metro. So is that what you've been led to believe is where that deployment is going to take place?
Like I said, the 80 positions haven't been allocated yet, so I couldn't say one way or another where they're targeting. It's not a pilot project. Those are 80 full-time funded positions, and they're good for the length of our contract, which is 5 years. Yeah, I've worked in Fort St. John. I've worked in the Lower Mainland. There's hospital wait times everywhere. You know, for paramedic crews, it's an hour, 2 hours, 3 hours, 4 hours. It's a provincial problem that you know, it's the same rural and metro.
Yeah, and I mean, I don't think there's any argument for sure that we need more paramedics. I mean, I think that, you know, especially the rapid growth that we've undertaken, and certainly south of the Fraser and the communities that have grown so fast, you know, and it hasn't been kept up. And you know, and adding this, I think there's value, of course, in that regard as well as getting additional cars to service this area. It's just drilling down to the process when we go forward to the ministry to say, okay, this is what we need, this is why we need it, and that's the business case in order to get those positions here. So I just needed to know what that avenue is to make that business case. But you're saying that you're not familiar with that.
Yeah, it's certainly not with our union, but
no.
The leadership role. I mean, we're trying to push it along as much as we can, and I'm sure you're familiar with how cumbersome that can be dealing with the government ministries.
Yeah. So maybe what we'll do, maybe what we can do, Councillor Martin, as a community health committee, and you know, the new mayor is going to determine whether, you know, that's going to continue or whatever. But this would certainly be something that would fall under, to get more information and to have a focal point as to who needs to be at the table to do the needs assessment and push that forward. So, yeah. So we'll do that.
Okay.
Great. Thank you.
Thank you.
All right. Can I have a motion to adjourn for council committee? Okay. All in favor? Contrary? That is